In pharmacology, a drug agonist is a substance that binds to and activates a specific receptor in the body. This activation results in a physiological response that is similar to the response produced by the endogenous ligand. There are several types of drug agonists that differ in their mechanism of action and therapeutic uses. In this video, we will discuss the different types of drug agonists and their significance in pharmacology. Part 1. Full agonists. Full agonists are substances that bind to a receptor and activate it to its maximal effect, Emax. In pharmacology, a maximal effect refers to the point at which increasing the dose of a drug no longer results in a further increase in the magnitude of its therapeutic effects. At this point, the drug has reached its plateau of efficacy, and any additional dose would be unnecessary or potentially harmful. The maximal effect of a drug is typically determined by its mechanism of action, pharmacokinetics, and the specific characteristics of the patient population being treated. Full agonists produce the same response as the endogenous ligand and have high efficacy. Examples of full agonists include morphine, which binds to the mu-opioid receptor, and albuterol, which binds to the beta-2 adrenergic receptor. Full agonists are often used in the treatment of pain, asthma, and other conditions. Part 2. Partial agonists. Partial agonists are substances that bind to a receptor and produce a submaximal response. These agonists have lower efficacy than full agonists and may act as antagonists at higher concentrations. Examples of partial agonists include buprenorphine, which binds to the mu-opioid receptor, and aripiprazole, which binds to the dopamine D2 receptor. Partial agonists are often used in the treatment of addiction and schizophrenia. Part 3. Inverse agonists. Inverse agonists are substances that bind to a receptor and produce the opposite effect of a full agonist. These agonists have negative efficacy and reduce the activity of the receptor below its basal level. In pharmacology, the terms inverse agonist and negative antagonist are sometimes used interchangeably. The term negative antagonist is less commonly used. Examples of inverse agonists include rimonabant, which binds to the cannabinoid CB1 receptor, and atypical antipsychotics, which bind to the dopamine D2 receptor. Inverse agonists are often used in the treatment of obesity and psychiatric disorders. Part 4. Allosteric agonists. Allosteric agonists are substances that bind to a different site on the receptor than the endogenous ligand and enhance its activity. These agonists may produce a more selective response than full agonists and have the potential to reduce side effects. Examples of allosteric agonists include benzodiazepines, which bind to the gamma-aminobutyric acid GABA receptor, and allosteric modulators of the metalbutyropic glutamate receptor. Allosteric agonists are often used in the treatment of anxiety and other neurological disorders. Part 5. Positive allosteric modulators. Positive allosteric modulators, PAMs, are a type of allosteric modulators, and as opposed to allosteric agonists, they work by enhancing the activity of a protein in response to its endogenous agonist or substrate. Positive allosteric modulators work by binding to an allosteric site on the protein and enhancing the activity of the protein in the presence of an agonist, which is the endogenous ligand or substrate that activates the protein. This can lead to an increase in the response of the protein to the agonist, resulting in a stronger physiological effect. However, in the presence of an antagonist, which is a ligand that blocks the activity of the protein, positive allosteric modulators may not have any effect or even reduce the activity of the protein. This is because the positive allosteric modulators work by enhancing the activity of the protein in response to an agonist, and not an antagonist. In fact, the presence of an antagonist may even prevent the positive allosteric modulator from binding to the allosteric site, thereby negating any effect of the positive allosteric modulator on the protein activity. Therefore, positive allosteric modulators are typically used to enhance the activity of a protein in the presence of an agonist, but they may not have any effect or even decrease the activity of the protein in the presence of an antagonist. Part 6. Negative allosteric modulators, NAMs, also known as allosteric inhibitors, are substances that bind to a specific site on a receptor distinct from the agonist binding site and decrease the activity or response of the receptor. Unlike agonists that activate the receptor and produce a biological response, NEMs have an inhibitory effect on the receptor's function. When a negative allosteric modulator binds to its specific site on the receptor, it induces conformational changes that result in a reduced response to the agonist. This can involve a decrease in the affinity of the receptor for the agonist, impairing its ability to bind effectively, or altering the receptor's downstream signaling, leading to a diminished or dampened response. The use of negative allosteric modulators can provide a means of selectively inhibiting the activity of a receptor without completely blocking it. This offers the potential for fine-tuning the receptor's response and may have therapeutic applications in managing conditions where excessive receptor activation needs to be controlled or modulated. An example of a negative allosteric modulator is the drug NDESMETHYLCLOZAPINE, NDMC, for the dopamine D1 receptor. NDMC is a metabolite of the antipsychotic medication clozapine. It acts as a negative allosteric modulator at the dopamine D1 receptor, reducing the receptor's activity when it binds to its specific site on the receptor. By binding to the receptor at an allosteric site, NDMC decreases the affinity of the receptor for its natural agonists, such as dopamine. This leads to a reduced activation of the receptor and a decrease in downstream signaling. The negative modulation of the dopamine D1 receptor by NDMC may contribute to its antipsychotic effects and the modulation of dopamine-related processes in the brain. It is worth noting that there are various negative allosteric modulators for different receptors, and the specific examples and applications can vary depending on the receptor system and therapeutic context. Part 7. Biased agonists. A biased agonist is a type of agonist that selectively activates certain signaling pathways or conformational states of a receptor, leading to a unique pharmacological response compared to other agonists that activate the same receptor. In other words, biased agonism refers to the idea that different agonists can induce different signaling events via the same receptor. An example of a biased agonist is TRV-120,027, Greek small letter beta ARRESTIN biased agonist for the angiotensin, the second type 1 receptor. By preferentially activating the Greek small letter beta arrestin pathway while minimizing G protein activation, TRV-120,027 can produce distinct physiological effects, such as improving cardiac function and contractility while reducing vasoconstriction, which differs from the effects of traditional angiotensin, the second receptor agonists that activate multiple pathways simultaneously. Biased agonists offer potential therapeutic advantages by targeting specific downstream pathways while minimizing off-target effects. Part 8. Superagonists. A superagonist is a substance that binds to a receptor and produces a stronger or more pronounced biological response compared to the endogenous agonist or a typical agonist for that receptor. One example of a superagonist in pharmacology is the synthetic opioid analgesic called fentanyl. Fentanyl is a highly potent opioid that acts as an agonist at the opioid receptors in the body, particularly the mu-opioid receptors. Compared to endogenous opioids like morphine, fentanyl exhibits a significantly stronger binding affinity and produces a more potent analgesic effect. Its superagonistic properties make it highly effective in pain management but also increase the risk of overdose and respiratory depression if not used carefully under medical supervision. Part 9. Coagionist. A coagionist, also known as a coactivator, is a substance that works together with another agonist to enhance the overall biological response at a receptor. While a single agonist can activate a receptor and produce a certain level of response, the presence of a coagionist can increase the magnitude or duration of the response by interacting with the receptor or other components of the signaling pathway. Coagionists often work in synergy to achieve a more robust or potent biological effect than either agonist alone. An example of a coagionist in pharmacology is the combination of benzodiazepines and GABA, gamma-aminobutyric acid. GABA acts as the endogenous agonist at GABA receptors, which are inhibitory receptors in the central nervous system. Benzodiazepines, such as diazepam or alprazolam, enhance the binding of GABA to its receptor, resulting in an increased inhibitory effect. The combination of benzodiazepines as coaguonists with GABA enhances the overall sedative, anxiolytic, and muscle relaxant effects, making them commonly prescribed for conditions such as anxiety disorders, seizures, and muscle spasms. Part 10. Coaguonist versus positive allosteric modulators. While both coaguonists and PAMs enhance the biological response, the mechanisms through which they achieve this effect differ. Coaguonists directly contribute to the response by binding to the receptor or acting on associated signaling pathways, while PAMs modulate the receptor to enhance the response of the primary agonist without directly activating the receptor themselves. Conclusion. In conclusion, drug agonists play an important role in pharmacology and the treatment of various medical conditions. The different types of agonists, including full agonists, partial agonists, inverse agonists, and allosteric agonists, have distinct mechanisms of action and therapeutic uses. Understanding these different types of agonists is important for the development of new drugs and the treatment of various diseases. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or seen in this video. Please like, share and subscribe.